Well, as Dr. McLaughlin just said, we've had a lot of activity epidemiologically. We've also had a great deal of activity in our vaccine shipments. Since the beginning of October, when we first began receiving vaccine, we initially had about 4,200 doses, and since that time we have been allocated from the Centers for Disease Control almost 160,000 doses. This week we should go over 160,000. Not all of that vaccine has arrived yet, but the vast majority of it has. Since then, the vaccine that we've received, we've shipped about 116,000 doses to providers. Over 30,000 of those doses were distributed within the last 2 weeks. So a lot of vaccine is becoming available daily within the state. We've had reported administered about 43,000 doses. However, we know the actual doses distributed are much higher than that because we have some lags in reporting from our providers. The providers that have been receiving vaccine have included our public health centers, physicians' offices, clinics, native corporations, pharmacies, school systems. Providers throughout the state have been getting vaccine during this time. We initially estimated that about 300,000 Alaskans might be interested in receiving this vaccine. So the fact that we're going to be topping 160,000 doses available sometime during this week means that over half of the vaccine should be available for people that wish to be vaccinated. It's a little bit uneven. In some locations you may be able to find vaccine more readily than others. But we are beginning to hear providers in some areas of the state beginning to report that they have vaccine going unused in their refrigerators because not everyone is a high-risk group. However, they are receiving requests from people who are not in priority populations that they do wish to get vaccinated. And so with that in mind, and the fact that we want to be sure that Alaskans have the opportunity to receive vaccine prior to the rest of the remainder of the holiday travel season, beginning tomorrow, December 1st, providers will be allowed to use available H1N1 vaccine for any person in the general population or a priority group who wishes to receive the vaccine. Now, it's important to remember that we continue to emphasize that priority populations are still just that. There are priority populations. We do hope that people in these groups will continue to come in to be vaccinated. And the priority groups include pregnant women, children and young adults who are aged 6 months through 24 years, healthcare workers and emergency services personnel, household contacts of children who are less than 6 months of age because these children do not have a vaccine available for them that can be used, and persons who are 25 through 64 with chronic health conditions such as asthma. Again, these are our priority groups, but we do continue to emphasize that they receive vaccine, but we now think it's time to go ahead and open this up for all Alaskans wishing to be vaccinated. So why now? If we don't have quite enough vaccine for all of these people who are in the priority groups, why are we going ahead and opening it up? Well, as I mentioned, we are already hearing from providers that they have vaccines sitting in their refrigerators. Our goal is to make sure that we get vaccine out of refrigerators and into the arms or noses, in the case of nasal vaccine, into the arms or noses of Alaskans, because that's where it's going to do the most good, not within refrigerators. We will continue to monitor vaccine distribution and uptake, and we will continue to work with Alaska providers to make sure that distribution continues as long as there is demand anywhere in the state. We do want to make sure, though, that all Alaskans have the opportunity to receive this vaccine. So again, beginning tomorrow, December 1st, we will be opening vaccine, H1N1 vaccine use up to the general population. So I think now we're ready for questions.
I think we're ready for questions. Let's check the room first, and then we'll turn to the phone.
This could be for either one of you. I guess you kind of touched on this, but how important is it that you're opening up to the general public now as we get into the big holiday travel and Christmas season coming up?
Well, we know that vaccine is the best and most effective way to prevent transmission of influenza virus. So as people are interacting over the holiday season, we would like to go ahead and give them the opportunity to receive protection before then. But the important thing also to remember is even after the holiday season, as Dr. McLaughlin has already said, we continue to see influenza on into the spring. So even if people aren't vaccinated before Christmas, before the travel rush, it'll still be a good idea to get vaccine as it continues to become available around the state.
How has I guess your response been as far as projections on how many people you thought would come forward and get vaccinated in those priority groups?
We're not requiring providers to report which priority groups are being vaccinated for each individual, so it's a little hard to say. But I do know that Alaska providers have been working very hard to do outreach to priority groups within their practices, within the public health center areas. They have been reaching out to try to make sure that people are aware of the vaccine's availability when it's available. And for example, the municipality of Anchorage has been working very hard to make sure that they are reaching one of our priority groups, which is children. And so their school clinics have very much been helping to target that population. But all providers are basically doing the same thing, trying to reach out to anyone in a priority group.
Any questions from the phone?
Sure. So I didn't quite hear, is the supply of vaccine increasing at a great rate? Did you say there's 30,000 in the last 2 weeks?
We've distributed more than 30,000 in the last 2 weeks. We're getting 12 to 15,000 a week allocated to us, but we actually don't know exactly how many doses we're going to receive until we receive the allocation amounts from the Centers for Disease Control each week. But it does appear that by the end of December we will have well over 200,000 doses available in the state. So in general it's increasing 10 to 15,000 doses a week. But as the manufacturers are continuing to have more available, our numbers may jump much more than that. It's a little difficult to say until we get the actual allocation amount.
And how does that compare to what we were getting in October?
Well, at the beginning of October, we had 0, and the first allocation we got was 4,200 doses. And then it slowly increased from there. So I think for the last few weeks, we've been getting 15,000 or so doses every week available.
Can we assume that if you go to your pharmacy that they'll have it? Are they getting resupplied often? And have providers, have more doctors and nurse practitioners signed up to distribute it? Or what's the situation there?
Well, as we have it available on a statewide basis, we are trying to make sure that we resupply providers of whether they're pharmacies or whether they're planning to do community clinics as we have vaccine available. So the answer to your question is on any given day, you may be able to check with a provider and find that they have no vaccine, but the very next day they may have more. So we are continuing to provide vaccine to all providers as quickly as we can. It's a little difficult to say on one particular type of provider over another.
Okay. I noticed that the Anchorage Neighborhood Health Center almost always has it, but the pharmacies maybe aren't quite that regular. Is that accurate?
The municipality of Anchorage is trying to make sure that they provide vaccine through the Anchorage Neighborhood Health Center, so it will be available on a walk-in basis. They are also making sure to emphasize children in the school-age setting. Jason, I don't know if you would like to say anything about that. Jason